November is Diabetes Awareness Month, and in recent months, a class of drugs used to treat diabetes has been getting a lot of attention as celebrities and social media influencers turn to them for weight loss. You've likely heard of Ozempic and other drugs like it. So what are these medications and what are the risks? Dr. Daniel Shafran is the founder of the Edmonton Diabetes and High Risk Foot Clinic. He joins us in studio today. Doctor, thank you so much for your time.
Thanks for having me.
So first off, let's talk about just Diabetes Awareness Month in general. Just a little bit about, what you want people to think about right now, when it comes to this condition.
Yeah. Diabetes Awareness Month is, it's important because it gets people thinking about a really common problem. It affects about 10% of all Canadians. And it affects whether you're young or old or whatever race or background you're from. So it's really important to bring awareness to make sure that people are aware of the signs and the symptoms and are getting appropriate help for that.
Okay, and so one thing that people turn to for help is Ozempic, but Ozempic has been kind of, for lack of a better term, co-opted in a sense. Talk to us about, what you're hearing, what you're seeing, and your just response to everything that's happening right now.
It's a very open-ended question, but I love that. I'll be able to, there's so much to talk about with Ozempic. It is a phenomenal medication for people with diabetes. It's been shown to lower blood sugar. It helps with weight loss, which is why it's so popular. And in very large, well-done, randomized scientific studies, it's found that it reduces the risk of cardiovascular events like strokes.
Right.
And in fact, fewer patients who received Ozempic compared to those on placebo, fewer people died. So this is a life-saving medication that improves people's quality of life, that's easy to take, it's once a week, and it's very safe. Not without side effects, but it's very safe.
So, is there, I guess, competition for this drug right now, and does that raise concerns for you?
So there is competition. Ozempic is from a class of medications called GLP-1 receptor agonists. And Ozempic is just a brand name for a molecule called semaglutide. And semaglutide is available in different doses and different forms. And people may have heard about it not only as Ozempic, but also as Rybelsus or Wegovy. There are other molecules from the same class and similar classes. One that just launched in Canada last week is, the brand name is Mounjaro, for a molecule called tirzepatide. This is an agonist, or meaning it activates not only GLP-1 receptor agonists, or GLP-1 receptors, pardon me, like Ozempic, but it also activates another receptor.
Right.
And regardless of which one is more impactful, the data so far in Mounjaro shows it does more blood sugar lowering and more weight loss than even Ozempic does.
Right.
So this is a really exciting time to be treating people with diabetes.
But still related to the kind of the weight loss phenomenon, Mounjaro, that's also potentially could help people with weight loss, right?
Absolutely. So in fact, in patients with diabetes, it caused twice as much weight loss as Ozempic.
Okay. So talk to us locally. What's the situation like here? Is there a supply issue? What do you tell clients who are needing this drug specifically for diabetes?
So unfortunately, for the last month or so, there have been shortages with Ozempic. And so patients are calling our office. They're having a tough time depending on their pharmacy, where they used to be able to get 3 months at a time. They might be able to get 1 month at a time. And it's been a big challenge. Mounjaro was actually approved by Health Canada a year ago, but the company who makes it didn't launch it because they've spent the last year building up supply.
Right.
So this is great because now there's another option that's really helpful that patients could potentially be switched to. There are other options as well, whether it's Rybelsus or other medications in that same class. But Ozempic is covered by Blue Cross, which means for patients who are 65 and up, Albertans who are 65 and up, have great coverage to Ozempic that they don't have for other drugs in that class. So it makes it very challenging.
Interesting. Okay, so what does your crystal ball say? Are the manufacturers, are they stepping up? Will the supply crunch kind of be eliminated in the months to come?
I certainly hope so. I mean, these are big companies that are they're very acutely aware of the shortage and the impact it's having on patients, and they are literally building factories to make more of these medications. So it will be alleviated. It's just a matter of when. It looks like for the next few months at least. There may be on and off shortages with Ozempic, unfortunately.
Okay.
But hopefully as more competitors enter this space, that will be alleviated.
And I guess finally, just before we head to break here, just when it comes to diabetes and Diabetes Awareness Month, for those who even don't have it, what do you want us to think about in terms of, diet, exercise, all that stuff related to diabetes?
Yeah. My advice is generally pretty simple. We want people to eat a healthy, well-rounded diet. Don't follow any extreme fad diets because the data shows they're not sustainable. Check in with your primary care practitioner regularly to get screening blood work done, and be aware of symptoms like excessive thirst, frequently urinating, problems with your feet, problems with your vision. It can affect a lot of different systems, which is why it's so important to catch it early and treat it early.
Okay, I'm already thinking about that right now. Doctor, thank you so much for coming in and for your time. It's greatly appreciated.
Thanks for having me.